So today we're going to be exploring the findings from an IPPO review into access to early years childcare for ethnic minority families, considering the evidence on enablers and barriers to participation. So I wanted to just offer a little bit of framing context for this review. It's particularly timely, I think, to be publishing it this month, given that one of the UK government's 5 missions is to break down barriers to opportunity through reforming childcare and education systems. And we've seen clear recognition from the Secretary of State for Education that delivering on this mission is largely about early education and childcare and addressing the significant gap that currently exists in enrolment in childcare between rich families and poor families in the UK. So we know that the UK government has committed to what they call a long-term plan to make early years education and childcare more widely available, accessible and high quality. We perhaps don't yet know enough about what that means in practice. We've had some early actions from this month. Parents of children aged 9 months to 3 can access their 15 hours of free childcare, and that will be increasing to 30 hours from next September. And we've also seen the recent announcement about the creation of 3,000 new state nurseries. But there are already suggestions that the allocated funding for this childcare expansion is insufficient, and that the plans don't take sufficient account of challenges in recruiting skilled childcare staff. And there are other key considerations, in particular, how to ensure that provision is addressing the needs of hard-to-reach groups and addressing the significant regional variation in quality and access across the country. So we're hoping that the findings from this review can dig into some of these complexities and these nuances in this really crucial question of how we ensure that we're delivering high-quality childcare for children and families across the UK. And we're looking forward to a really rich discussion today with our panel and with all of you. We're joined by a fantastic panel with insights and experience on this from across the UK. In alphabetical order, Chantelle Haughton is the founder and director of the Diversity and Anti-Racist Professional Learning, or DARPL, for schools funded by the Welsh Government. And she's also co-chair of the Welsh Government Steering Group for Anti-Racist Action Planning for Early Years Childcare and Play, as well as the former vice chair of the BAME Education Network in Wales. And Chantelle's joining us from another engagement, so she'll be joining us slightly later. Rebecca Johnson is head of early childhood education and care and childcare in the Welsh Government. Rebecca, that is such a long job title. I knew I was going to fluff it. She's kindly joining us today on behalf of Dawn Bowden, Minister for Children and Social Care in the Welsh Government. Neil Leitch has been CEO of the Early Years Alliance since 2008, which is an educational charity and membership organisation in England dedicated to improving early childhood care and education. Neil has been involved in campaigns ranging from fair funding and mental health to successfully reversing government plans to relax adult-to-child ratios in early years settings. And Miriam Rana is from the community-based Daisy Chain Early Years Project, which is based at Crossreach in Glasgow and runs play-based interventions designed to improve the lives and life chances of children and to strengthen family relationships. Miriam has great experience in delivering co-designed approaches with families that address cultural barriers. So before we hear from our panel, I'm going to hand over to my colleagues, Alexis Pyler, who's a research associate at the Wales Centre for Public Policy. Alexis is working on a range of projects currently, including looking at tackling housing inequalities and loneliness inequalities. And Amanda Hill-Dixon, who's a senior research fellow and programme director at the Wales Centre for Public Policy. Amanda leads work on inequalities and with public services more broadly. So Alexis and Amanda are going to take us through the key findings and recommendations from IPPO's review. As I said, please do add your questions, add your comments in the chat, and we'll pick these up during the discussions as we go through. But that's enough from me. Amanda, Alexis, over to you.
Brilliant. Thank you, Sarah. Lovely to see so many people here today. Yes, so I'm just going to say a few words to introduce the research before I pass over to Alexis. And just to kind of situate us, Alexis and I work for the Wales Centre for Public Policy. We're the Welsh partner of the International Public Policy Observatory, and we do very similar work connecting policymakers with evidence and expertise, specifically in Wales. So this research was developed with the Welsh Government. It came out of kind of initial conversations we've been having with them over the last few years about how we can meet their evidence needs in relation to tackling inequalities. And it builds on work that we at the Wales Centre for Public Policy did to inform the Welsh Government's Anti-Racist Wales Action Plan, which was published in 2022. So the questions that Welsh Government colleagues posed to us over the last year or so are here on the screen. You can see, so the first one was about sort of what evidence is there about the nature and scale of the challenge in terms of supporting more children and families from ethnic minority backgrounds to participate in early childhood education and care? What are the barriers and enablers to that participation? Second question there. And then looking kind of at what interventions have been tried to encourage participation in early years education and care amongst ethnic minority children and families, and how far, crucially, have those interventions been effective? So that's kind of rapid evidence review that the Epicentre at UCL delivered. And then lastly, looking more broadly, how have other countries approached ensuring equitable participation in early years childcare and education for ethnic minority families and children, and other minoritised or disadvantaged groups. So just a few notes on terminology. So as we've said in the research, we recognise that there's no universally accepted or kind of sufficient term to describe the diversity of groups which may or who may experience racism in society. We've chosen to follow the Anti-Racist Wales Action Plan terminology in using Black, Asian and minority ethnic and ethnic minority as shorthand. And we also in the research refer to disadvantaged families or communities. And of course, these groups are not interchangeable, but we decided to widen the search to include evidence relating to disadvantaged children and families, to make sure that we were drawing on all of the best and kind of potentially relevant evidence that is out there. And then one other note on terminology, which is just to acknowledge that the kind of key term for this area of policy and practice in Wales is early childcare, play, learning and care, which is different to the term you see here. We've tended to use early childhood education and care because it's what is used most commonly in a sort of global research context. But we'll use both terms today. So just setting out a bit of global context here, the headline is that early childhood education and care is a global priority for many kind of supranational bodies and governments around the world. It's seen as key for reducing educational or social inequalities over the life course. So it aligns strongly with many of the UN Sustainable Development Goals in terms of providing quality education across the life course, reducing inequalities and reducing and abolishing poverty. It's also recognised by the G20 initiative for early childhood development, where there's an emphasis on quality childhood development programmes. And this is partly because there's strong research indicating that the most disadvantaged children are the most likely to benefit from early care. But on the flip side, there's also evidence showing that more disadvantaged children are often less likely to participate, unfortunately. Connected to that, in high income countries, demand often exceeds supply. So many families, as many of you will be well aware, are unable to locate or afford or access the childcare that they need and wish for. Bringing this to kind of a closer to home UK and Wales context. So as Sarah outlined already, this is a rapidly shifting policy and practice area with kind of thankfully increasing attention on it. There are differences in practice and emphasis across Wales and England, which this research has kind of focused on. So in Wales, as I said, the focus is kind of on early childhood play, learning and care, not just childcare, and it puts kind of play and learning at the centre of that. Currently, all children aged 3 to 4 are entitled to 10 to 30 funded hours per week, but and there's also the kind of core programme of Flying Start, which has historically been targeted at disadvantaged areas for all 2-year-olds, but it's expanding to all 2-year-olds. And then there's also a commitment springing from the Anti-Racist Wales Action Plan to make sure that the early childhood play, learning and care system in Wales is anti-racist and kind of promotes equality, diversity and inclusion for all children and families and practitioners. And then in England, the focus is more on childcare in policy terms, although obviously in practice terms, it's kind of, you know, play and learning and care is at the centre of it as well, often, usually. And there's, as Sarah said, there's an expansion of provision in England. One other dimension that Sarah didn't mention is that one of the ways that the expansion is being enabled or funded is due to the relaxation of adult-to-child ratios. So there's now slightly more children per adult allowed in childcare settings, which obviously has potential implications for quality. So I'm going to pass over to Alexis now to share some of the findings from all of the work with you all.
So what did we find? And I'm going to try to be aware of time so we can leave a lot of space for discussion. And my kind of goal with this portion is to be able to signpost you all to the resources that we're launching today and provide you kind of a good basis for diving into that catalogue, because as Amanda and Sarah have alluded to, this is what we're launching today as a whole kind of package of outputs. And I'm going to focus this portion of my presentation. I'm going to do it in two parts. I'm going to focus on the global UK-wide recommendations and findings that are based on a rapid evidence review of the academic literature and an international policy scan trying to synthesize global practice and addressing some of our research questions. And then I'm going to dive into really briefly how we tried to go from translating that global evidence base to the contextualizing it to the local circumstances in Wales, which is detailed in our workshop insight note. And so just to preface, I'm not going to go into our approach. The various ways that we've approached and the different methods that we've used throughout this project are detailed in all of the outputs that have now been launched onto our website. And you can dig into the rapid evidence review there. You can also see the policy scan underpinning all the recommendations that I'm going to present to you now. So what did we find? We have some really key overarching findings that we found across both of those evidence sources. So across the rapid evidence review and the international policy scan. Many of these will be not very surprising to you all, but I think they lay a really good foundation for discussion. So we found that government-funded entitlements can increase uptake, but they really need to be tailored to target population needs. And this is because universal approaches can overlook the distinct participation challenges specific communities and places might face. And so a key finding that we have put forth is that although cost is a significant barrier to many, it's only one part of the solution. And we really need to dig into the other cultural, social, and structural barriers that people might be facing when trying to access EC. And so the research, the international literature, but also the different policies that we scanned really highlighted concerns about quality, cultural sensitivity, and the adaptability and needing to be more adaptable and tailored to the needs of specific communities, especially ethnic minority children and families. And really key to this is the diversity, not only of staff that are working in places and in leadership roles, but also that settings themselves are employing diverse practices and being inclusive in not only practice, but also in the policies of their establishments. We found that community relationships are essential. Trust and relationships were key themes across not only the international policy scans, but also repeatedly throughout the literature that we reviewed, and play a key role in increasing uptake. And going back to kind of a point that has already been made on the call, workforce quality, morale, and retention really do actually impact EC availability, but also perceptions of appropriateness. So whether it's of suitable quality for somebody to place their child there. And so two really kind of key challenges that were more structural that we highlight in our report are accessibility gaps. So there's still gaps in awareness, reach, and participation for ethnic minority children and families across the UK, and also data adequacy gaps. So there are gaps around the uptake and the perspectives, not only around the uptake, but also the perspectives and experiences of ethnic minority children and families. And we need to do more to address those gaps and address the gaps in the lack of routine evaluation to better inform not only the design of policy, but also to lead to improvements. Key themes for action. Our research led us to identify 3 key areas for action across the findings, and we've grouped our recommendations underneath these. The first one is to develop the need to develop a bespoke and integrated strategy to really adequately address the multiple and interrelated factors that are affecting access. The second is to address social, cultural, and practical barriers. There's a need to better understand and respond to the needs of specific communities and develop more culturally sensitive practices. The third one is community outreach and engagement being key. Within these 3 themes, I'm going to go into them into a little bit more depth now to be able to highlight them. So the first one is developing an integrated strategy where we make 3 kind of key we make 4 key recommendations here. One is around developing a long-term comprehensive approach to addressing the gap, but really that approach is integrated, connecting with employers, community institutions, and other government services to better reach and support families. Alongside that, it's really important to allocate resource for evaluation of ECC-related interventions as a part of policy design and experimentation, and taking that longer-term view, because benefits and outcomes can take time to realize. Routine ethnicity data collection is really key to that. Our research found that at the global level, there is this lack of routine data collection, but also that the reason why we put forth this recommendation to develop a long-term comprehensive approach is because we took inspiration from other countries that were developing a much more integrated approach to addressing the gap. And by integrated, we mean an approach that includes connecting these different employers and community institutions and connecting up services that people might be accessing. So we also advocate for taking kind of an experimentation approach. And when we refer to that, we refer to doing this kind of type of policy by trying and testing and learning. So a key kind of example that we highlight in our report is Bulgaria. Before, in advance of rolling out a policy on universal fee removal in 2020, Bulgaria actually conducted a national randomized control trial to understand what approach would work most effectively for tackling the access barrier in their context. Under the theme of addressing social, cultural, and practical barriers, we think it's really key to develop cultural sensitivity inclusivity programs for ECEC settings. Key to that as well is developing a workforce strategy to really increase the diversity of staff and improve sector retention, quality, and professionalism, accreditation being really key, and also to ensure minimal burden of proof for free or subsidized ECEC services. And this is because inclusive policies that respect and value cultural diversity are key to developing approaches that are not only approachable, but also acceptable to families. And it's not just about respecting and valuing cultural diversity. Our research also highlights that there's a range of factors that settings should be considering, such as their opening hours and how those might be exclusive to certain people of certain backgrounds. Things like eligibility criteria can also get in the way, or application processes that aren't clear, simple, and easy to access. And so our final theme for our recommendations are around community outreach and engagement. Really key to this is adopting a relational approach to outreach and delivery. Things that we put forth are international practice around using home visits, community engagement, and trying out home-based ECEC support where appropriate for specific groups. Also trying to develop really a community-oriented strategy and developing that alongside developing community partnerships and engagement, and trying to get voice into the ongoing development and implementation of policy and provision. And the last one that we really put forth and advocate for is national and local governments working together to actively recognize and resource and support cultural brokers across the ECEC sector. And this was because the global evidence showed that working with, having strong working relationships were really key to increasing and sustaining uptake, but also that these kind of community brokers and community liaisons have a key role because they build those trusted relationships. And you can do that by working with community leaders, healthcare providers, and social workers to be able to access information on entitlements and assist families with application processes, for example. And that type of support helps to dispel misconceptions in communities. But training is needed. And our policy summary goes on to highlight different examples of how this is playing out in the global space. And so how did we translate the global to the local? And I'm going to go really quickly through this. So we worked on developing a systems map by doing that through a series of engagements and workshops. And we brought all of the data together. So the rapid evidence review and the policy scan alongside gathering local intelligence and insights into an evidence synthesis map to view the evidence as a system. We wanted to be able to see, okay, where are the gaps and where are the opportunities? And then the second bit is we developed a theory of change, and that also has been launched onto the website. Really key to this is we used an underpinning framework. So this framework underpinned not only the rapid evidence review and our systems map, but it was kind of key to being able to visualize the evidence and see it as a system. So we wanted to understand how we could go from need to outcome. And we know that there's a range of interventions that can be done on the demand side, so to directly support children and families, but also there's a range of interventions and evidence on the supply side, so things that providers, practice and policy can be doing to better support and increase access. And we wanted to see access as a journey. And so how do you move from an initial perception of childcare need all the way towards realizing childcare benefits and outcomes? And that's the underpinning framework between kind of our different evidence sources and the evidence synthesis map. So here is our theory of change. We ended up trying to identify and prioritize with Welsh Government through working with local stakeholders. What are the key barriers that they should be focusing on? What are the key outcomes that people would like to realize in Wales? And really taking the evidence-based recommendations that we've put forth and prioritizing them. And what came through loud and clear is that, at least in the Welsh context, there's a clear focus on needing to integrate community into the ECPLC approach in Wales. And so we did some rapid prioritization, came up with 4 kind of key focal areas and highlighted some challenges in the Welsh context. And that's our theory of change that you can dig into more in the workshop insight note and on our publication page. And so I'm going to leave it there and hand it back to Sarah.
Thank you very much indeed, Alexis. Do keep your questions and comments coming. But I'm now going to invite Rebecca Johnson to offer some thoughts from the perspective of the Welsh Government on some of the findings and recommendations in the report. Rebecca, over to you.
Thanks very much, Sarah. It's great to be here. So as Sarah said earlier in our time together, I head up policy in Wales for early childhood play learning and care. And first of all, wanted to give apologies from our Minister for Children and Social Care, who really wanted to be here today, but unfortunately her diary prevented that from happening. I really commend to you this work. Alexis has romped through it at pace. There's a lot of detail. I worked with Alexis and the team on this for the last most of last year. And even for me today, there's a lot to kind of revisit and get to grips with. So I'd really encourage you all to take a good look at the resources that are now available online. And it's certainly been a huge pleasure and privilege to be part of this pioneering research and see the launch here today. I'd particularly like to take the opportunity to thank the International Public Policy Observatory and the Wales Centre for Public Policy and all the people that we've met in the last year who have participated in this work. And to extend our gratitude from us in the Welsh Government and the people across Wales who've been involved in the work for the time that you've taken on the project. So as you know, and as has already been mentioned, in Wales, we're committed to eradicating racism. And our aim is to create a nation where everyone thrives and feels valued. We want a stronger and fairer nation that is proudly anti-racist. And that's not just in the childcare and play space, that's right across everything we do. Our aims for an anti-racist Wales and the work we need to do to get there are set out in our Anti-Racist Wales Action Plan, which you can also take a look at via the internet. We have within that plan 11 actions that are specifically for childcare, and the scale of the work that is required is clear and is demanding, but we're up for that challenge. That also means that it's a challenge for each of us that work on this. It's a challenge for us personally in the way that we do our work. And we are really fortunate to have sector stakeholders who are committed to working with us. We take a very collaborative and inclusive approach to policymaking here in Wales. And there's a huge amount of commitment to anti-racism, which I find humbling as I work with the various people across Wales. I particularly want to mention the Diversity and Anti-Racist Professional Learning Team, who we've worked with. So that's DARPL, and you will hear from Chantelle later. They are anti-racism and childcare experts and have been integral in our journey. So by working with partners and engaging the sector and having courageous policy conversations where we are prepared to be challenged personally and in the development of policy, I am confident that we can meet the challenges that are set before us. And the research today is really important. And what has come through strongly for me from this research is the need to take an integrated approach. and engage minority ethnic communities in Wales and engage them in developing anti-racist childcare and play provision. Perhaps one of the most important steps we have taken in Wales is to acknowledge the need to place lived experience at the heart of our work. This is about ensuring that what we do, as well as how we do it, is anti-racist. We have recruited 9 community mentors, which are people from a variety of backgrounds from across Wales. They are an integral part of taking forward our anti-racist work, working with the Welsh Government and sector partners to develop an understanding of lived experiences in childcare. This is really important to me personally, bearing in mind my background. For those who can see me on screen, can see that I'm a white woman, middle-aged, probably you can tell that too. So it's really important that I hear and bring in that breadth of voices into our teams and the work that we do. So looking ahead then, I also want to recognise that Cullum, who represent the 5 leading childcare organisations in Wales, in partnership with DARPL, have developed a toolkit aimed at creating an anti-racist culture in childcare settings. So that offers practical advice to settings on how they can embody and apply anti-racist principles. This toolkit emphasises the need for engagement with parents, carers and communities. It outlines steps settings can take to build relationships with local communities. Advice is also offered on the use of equipment, resources and activities to support culturally sensitive provision to ensure childcare settings are inclusive and welcoming to all. The role of the childcare workforce is crucial in our approach. We've taken some time to gather data around that, and we recognise that settings and staff need to support to develop their own anti-racist approach. So we have developed in partnership with Cullum and DARPL specific anti-racist training for childcare practitioners. And that's another piece of work that I'd commend to you that is also available on the internet through the DARPL website. Today's research is clear that we need a diverse workforce in childcare, and we aim to ensure that our childcare and play settings reflect the communities they serve. This includes building a more diverse workforce and understanding the experiences of Black, Asian and minority ethnic people who currently work in the sector. Now, I've already mentioned the challenges around data, or rather lack of data. And this also comes out strongly in the research that's been published today. We know that there is a lack of available data on the experiences of Black, Asian and minority ethnic people when it comes to childcare. But we are prepared to tackle that challenge and not seeing it as a barrier. We are working hard to improve the situation, and we aim to develop small-scale qualitative research projects based on the lived experience of Black, Asian and minority ethnic people from across Wales, including those who work in childcare and play. The findings and recommendations from today's research offer us, that's all of us, that's us here in Wales and across the UK and further afield, offers us clear challenges, and we are carefully considering and reflecting upon these. Achieving our goal of an anti-racist Wales can only be achieved by working closely with all our partners in a continued spirit of co-production. We will ensure we build on the insights highlighted in the research so that we can continue to build the inclusive anti-racist Wales I know that we all want. So, diolch yn fawr. Thank you very much for the time this afternoon. I will be staying on for the panel discussion later and perhaps can take more questions then. Thank you, Sarah.
Thank you very much, Rebecca. And yeah, really interesting just to hear your reflections on the importance of an integrated and systemic approach, but also the need to work with communities and embed them at the heart of policymaking. I think that's something that people are increasingly cognizant of, but you don't always see actually implemented in policymaking. So it's really great to hear the actions the Welsh Government is taking to ensure that.
Thank you.
I'm gonna bring Neil in now, who's going to offer his thoughts on the findings from the report and perhaps some reflections on what this might mean for the Early Years Alliance's future campaigning.
Thanks, Sarah, and thank you for the opportunity to say a little bit about the report's relevance and I guess, the context in which we find ourselves operating in England, so there are some differences. I confess, when I was thinking about what I should say, my mind flicked back to this particular slide, and some of you may recall that back in, I think it was March of this year, the UK was voted the second most miserable country in the world. So I sort of felt that I should give you a bit of a health warning that my comments today are not likely to change that statistic, but I hope that I might end up on a slightly more positive note. So just a little bit about the Alliance. For those of you who may not know, the Early Years Alliance is the largest early years membership charity in England, and we represent around 14,000 nurseries, preschools, childminders, and baby and toddler groups. The thing that makes us, I would suggest, different from other membership organisations is that we're also one of the largest voluntary sector providers of early education and care in the country. And we currently operate around 41 settings exclusively in areas of deprivation. And in operating these settings, we support over 3 times the national average of children receiving pupil premium, on care plans, and at risk. What is interesting, I think, is this time 5 years ago, we operated 132 settings. So we've had to close literally 2/3 of our portfolio due to financial viability. So I'd like to think that when we talk about the challenges of the sector, when we talk about disadvantage and marginalisation, we do so from first-hand experience. And as you will see from this slide, our mission is to ensure that all children, regardless of background, are given the best possible start in life. But I also wanted to be clear right from the outset that the best possible start in life does not automatically mean that every child from a very young age should be placed in an early years setting. But it does mean that there should be equity in access, because there is a wealth of evidence that demonstrates denying children's access to high quality care and education greatly impacts their future life chances. And a couple of months ago, I had a stark reminder of just how critical access to early education is. So indulge me just for a moment, but some of you may recall the awful floods a few months ago in Dubai. And I was working alongside the Department for Business and Trade, and I was one of the unfortunate individuals who was stuck in that airport for 2 days. And when I finally boarded the flight, I decided to watch a documentary on racial equality, slavery, and the impact on the children of those slaves. I know you're probably thinking, 2 sleepless nights, wouldn't you have chosen something slightly lighter? But I didn't. Anyway, as you can imagine, there were some awful moments within the documentary. And I can remember sitting there struggling to understand how people can hold such cruelty. But the thing that struck me most from the documentary was a reference to a decree embedded in the Alabama Slave Code 1833. So this was my screenshot, and it stated, "Any person who shall attempt to teach any free person of color or slave to spell, read, or write shall, upon conviction thereof by indictment, be fined in a sum not less than $250, not more than $500. And for me, if ever there was a statement that defined the power of education, that was it. It is clear that even in 1833, they knew the way to restrict humankind was to starve them of education. So if we fast forward to 2024, and even though this graph produced by Professor James Heckman, Nobel Prize-winning economist, illustrates that the greatest return on human capital investment is within the first 5 years of a child's life, we have been treated in England to endless policies that have done nothing to equalise opportunities for the most disadvantaged. In fact, according to the Institute of Fiscal Studies, an independent financial body, several recent early years policies have further marginalised the most disadvantaged. Policies that have exclusively focused on getting mums back to work, whilst nothing is said about the best interest of the child. And if you're a child within a family that does not meet that work criteria, there is little new that's on offer for you. Worst of all, these policies have driven providers to cater for more affluent parents in more affluent areas, Because as we ourselves have demonstrated, without adequate funding, you cannot operate in areas of disadvantage. And I appreciate that my comments are about general disadvantage and not specifically focused on ethnic minority groups. But I'm confident that I do not need to explain to colleagues in this particular seminar that the percentage of children and families from ethnic and minority groups who are disproportionately impacted by deep poverty and social inequality exists. So whilst this headline in The Guardian focuses predominantly on financial disadvantage, let me assure you, it extends to accessing early years care and education. Just a couple of weeks ago, we saw the publication of what was described as a world first study, which showed that England is one of the worst countries in the world for early education and childcare access, with 45% of families in England living in what is described as a childcare desert. And when you look at London alone, you'll see from this chart the link between affordability, pricing, and availability. So if you happen to be fortunate enough to live in Kensington and Chelsea, despite the higher charge rate, availability is considerably stronger. Whereas if you're living in Barking, the picture is somewhat different. In the most deprived areas, there are 3 children vying for every single place. And the net result is families located in lower socioeconomic areas are forced into making difficult decisions, such as staying at home instead of returning to work and paying for unfunded care and education. And I come back to the point, if you're not in work, your child is often denied access to early years care and education and is exposed to an increased risk of a life of disadvantage. But as I said at the beginning, I'm determined to leave you with some good news about how we might bring about change within the early years. I was at a fringe event the other day at the Labour conference, and I made the comment that the narrative of opposition is often completely different from the reality of office. And I'm hoping that is not the case. So I'm determined to leave you with some good news about how we might bring about change. So let me say this. For the first time ever, and Sarah, you alluded to this at the outset, we have a Secretary of State for Education who within 24 hours of coming to office has publicly stated that the early years is her #1 priority. We have a Secretary of State who just 8 days ago at the Labour conference said, so much in life depends on those crucial early years before school, when the gaps between rich and poor open up. It is my first priority. The life chances of our children and the future of our country demand nothing else. Again, as Sarah, you alluded to, we have the announcement of the government's initiative to create 3,000 nurseries and schools located in childcare deserts. So it's a start towards supporting disadvantaged and ethnic minoritized groups. But I think it's also important to understand that the vast majority of early years places are delivered by the private, voluntary, and independent sector. And that is where we need to address the problem of accessibility. That is why we need more investment, more accountability, and more evidence, as the report alluded to. We have a lot of data on disadvantage within the earlier sector, but we have little specifically on how it impacts minority ethnic groups. So definitely something the Alliance feels we should improve upon. Finally, I'll try and leave you with a positive thought, and I hope this quote offers at least some optimism. And it's the first part, really. Do not be dismayed by the brokenness of the world. All things break, and all things can be mended, not with time, as they say, but with intention. Nothing changes without intention. So I will be hanging on to those words and most definitely holding this new government to account. Thank you.
Thank you very much, Neil. That was a really eloquent, slightly depressing account of the challenges. But I think also you pointed to that ray of hope in that perhaps now there is the intention to do something to address some of those challenges you sketched out. I'm sure we will come back to that in the discussion. I'm going to bring in Miriam now, who's going to offer us her perspectives from running one specific childcare setting in Glasgow.
So I'm from Daisy Chain Early Years Project, which is in Govanhill in Glasgow, and we're a project that is part of Crossreach, and Crossreach is the social care arm of the Church of Scotland. So it's got lots of different services, but within our children and families, we have our project Daisy Chain. So to start with, I've just put some stats up about Govanhill. It is quite a unique area within Glasgow, just with the high proportion of ethnic minority families. So as you can see, it's 40% of the population are ethnic minority. And it's always been an area of migration as over different generations, lots of different groups coming in and settling in Govanhill, and it's ever changing. Very densely populated, which comes with its own issues. And these are some stats that I found at one point, just to kind of give an idea of the area. So specifically 6.2% are between 1 to 4 years old, and that's compared to the Scottish average of 3.8. And low-income families make up 70% compared to nearly 30% in Glasgow. So it's an area with lots of positives, lots of great things about it, but lots of challenges that go with it. So we've been in Govanhill for 15 years, and one of our main focuses is our come and play sessions. So these are sessions where the parent and child can come together to engage and play, and it's building that attachment through play while also providing the play opportunities for the child that include socialisation and all the learning outcomes that come from play. They're quite. They also bring inclusivity. So we have all the different nationalities. At one point, I was told that there's over 50 languages spoken within a 1 mile radius. So having all these families come to one group together to be united in the fact that they all have young children and they're all parents going through similar parenting struggles. And we very much, it's parent engagement. So having the parents realise the importance of play and having them engage in that play is quite important. We also run family support services. So that's one-on-one support with the families. So the relationship is built in the come and play sessions, and then it develops into the one-on-one support, and the families can dictate that support. And we do work to key outcomes, but we're finding that families, that's where their needs are met in those outcome areas. So they're able to direct that. We also do peer-to-peer support groups where we'd be looking at building relationships with the parents and also improving their well-being, but also giving parenting advice alongside that. And quite often in our family support, we're networking. We're engaging with the different community organisations and also signposting them to other agencies that are able to support them in a variety of different ways. So, as I said, we've been here for nearly 15 years, and it was mentioned before that relationship is key. Without a relationship, then you're not able to really support the families in the best way. But without trust, so a lot of the families that come, especially Romanian Roma families come, they don't trust statutory services. So we are almost like that in between. We're not a statutory service, but we are here to help you. We're here to build up trust for you to use the statutory services as well. As a safe space, the families know we're here. A lot of them just come knocking on our door, and we also get signposted from health visitors and social work and things like that. And as I said, lots of different third sector organisations that we link with, as well as our statutory partners such as the nursery and the schools. So being a very culturally diverse area, we need to make sure we have culturally sensitive practices. We do provide language support, but there's an obvious look to doing ESOL classes, so teaching English to people that English isn't their first language. But we have families coming to us with literacy issues. They're not able to even read the letters that are sent out, contact the nurseries to fill in applications. There's a real basic need there, and there's a step in between accessing ESOL classes, and so it's like building up that competence and confidence to engage in ESOL. And we also have to be culturally competent. So that's making sure that we understand different cultural viewpoints in terms of things such as parenting, but even timekeeping. So that if we are culturally aware, then we're able to overcome barriers or overcome preconceived ideas as to why someone might be displaying that behaviour. And we also encourage volunteering and employment support. So that can be volunteering with ourselves, finding other organisations they can volunteer with, but also even just building up your CV, anything along those lines. So we have a child-centred approach, and as I said, our come and play sessions, you come with the parent, but our childcare services, our play sessions are catered to the needs of the whole family, including the children. So their development needs are addressed, all the different curricular areas are addressed within our come and play sessions. It's also a stepping stone for accessing nursery provision. So coming along, they can come from birth, and they come along, they're used to that socialisation, they're used to the routine, they're used to being around other adults, so that when they take that next step into nursery education, they're a lot more confident, and the parent is a lot more familiar with that process and a lot more confident with sending their children. We have a variety of different sessions. We have sessions that cater to children specifically with complex needs, additional support needs. And we have a session catered to the Roma community. And that is because the Romanian Roma community specifically asked to be in a group where they can come and be together, because they needed that step before accessing that wider group. So they ask, we give. So feedback and continuous improvement is always a key area in Daisy Chain. We're always looking to get the parents' views heard, get feedback from them as to how they would like the sessions to go ahead, and then adapting our session to make sure that we are catering for that. We also are very aware of the community needs. So if there's a need in the community that we can see is not being met, for instance, our additional support needs group, then we will start that group within budgeting restraints, obviously. And vital, and at the slide before that just talked about advocating. We're also part of wider Glasgow City Council groups and Scottish Government groups. And quite often in these groups, the perspective of this community is overlooked. So we feel that when we're there, we're representing our families. So if something's been discussed and we can clearly see that the barriers they're facing are being ignored, we will speak up, we will challenge. So the barriers that we have to facilitating that support are funding, and we are a third sector organisation, and without funding we can't do what we do. Another issue is that system change in this area is needed that we don't have control of. So childcare availability is a real issue in Govan Hill. Housing crisis, status and benefits, all these things we can't control. We have to work our way around that. And with that, there's an ever-changing complexity of support required. So especially the obvious change of COVID bringing on new issues for these families. When something happens, whether it be a wider thing or something new within their family, and we have to figure out how can we support these families best. And it's about finding new organisations that might be able to be signposted to, or it could be just improving our understanding of a particular issue. But with all these barriers, we do also have new opportunities. So we've been doing a lot more work on co-design and co-production. And we've just finished a session this morning, actually, and our parents just felt left feeling so much more empowered and feeling that their voices were heard. But we have received so much information from those parents that is so useful in us understanding their journey, their unique journey, that we can't put our own feet into. We've had new funding opportunities where we're looking at a more flexible approach to childcare. So a lot of parents, especially in ethnic minority communities, seem to be more reluctant to put their children into childcare from a young age, but they do understand the benefits. So having a more blended option where they can choose to put their child in nursery for some of the time and come into a group where they can attend, and also getting that family support and getting that peer-to-peer group. So we're working on a test of change of having a flexible approach to childcare and how that benefits the whole family. And that is in partnership with the local statutory nurseries, but we've also got Glasgow City Council on board and Scottish Government to look at how the learning we can have throughout this 3-year funding period can be implemented in different areas throughout. So thank you for listening to me today.
Thank you so much, Miriam. It's so interesting just to hear about the provision that you've been developing with and for your communities. And I think a lot of what you said resonates with what Neil and Rebecca both said as well, in terms of the need to take a more holistic approach and to foreground that lived experience, as well as all the challenges around tackling disadvantage. So thank you. We are going to move to discussion shortly, but before that, we're going to hear from Chantelle Haughton. Chantelle, I introduced you in your absence before you were able to join us today. But if we could bring you here in now and listen to your reflections, both on the report and in terms of the future actions and change that you think is needed. And then please do, everybody on the call, continue to add your questions to the chat because we want to bring them into the discussion. But for now, Chantelle, over to you.
Thank you so much. So I'm coming with a reflection from Wales and coming with a Pan Wales vision, I suppose. I'm going to give you a little bit about me and the context of where I'm coming from, because positionality, when we're talking about anti-racism, is really important, because when we're talking about anti-racism, we're talking about racism. And who is she to be giving this reflection from Wales on this story? So you can see a pale-faced looking woman, middle-aged. I'm also a pracademic. My heartbeat is early years education, so I'm a principal lecturer in education, but in this hat I'm coming as the director and founder of DARPL, Diversity and Anti-Racist Professional Learning, which has been backed and funded by Welsh Government. I come to you in the story because I come from a tiny 1 mile community, which is Tiger Bay, Bute Town. People know aspects of Cardiff Bay, and we are a global community. So one of my grandfathers, for example, came in 1901 to Wales from Malaysia over the generations, and my husband is a first-generation migrant, making me a real mix in terms of my motherhood. And when we think about motherhood, it's really important that those stories are immersed in lived and professional experience. So unapologetically, we bring our own stories of lived experience to this work. Now, within the context of DARPL, I was the chair's brief for a piece of work that came out around Cynefin, the sense of belonging for Black, Asian and minority ethnic learners and staff in education in curriculum for Wales. What's happened in our Tiger Bay community, it's been prolific in race equity for many generations. So I know that Grampi Said and lots of our community in 1919 were really prolific in those race riots. And if we think about the context of now, what's different is we have an amazing opportunity, an optimal time with Welsh Government having the Anti-Racist Wales Action Plan, having the curriculum for Wales, which was very similar to the curriculum that I grew up in, with a very global perspective in it. So Mrs. Campbell, Mrs. Betty Campbell, was my head teacher, and you may have heard of her. If you haven't, please Google Mrs. Betty Campbell MBE. But she took me by the hand to school, and the global histories in Wales and the world, we lived and breathed them. You know, we could be classed in early childhood as, you know, growing up in poverty, and yet in richness we could hear, see, smell, taste, feel and know the world on our doorstep. So our playful environments, our education environments, that's what it was like. And community and Cynefin, the sense of really steeped in a sense of belonging way beyond physical or geographical knowing, is the crux of our work. And I suppose I'm immersed in the community, Welsh Government and education, childcare and play work. And to have all of the opportunities we have to really think about childcare, play and early years in this context is really being springboarded through anti-racist professional learning, which is where DARPL come into it. And we have a really multidisciplinary approach to that, whereas in a community of practice, we have people with a range of professional experiences and lived experiences. So small grassroots and bigger organisations involving people with lived experience as well as professional are co-creating and shaping the professional learning, which really is the heartbeat. We call it gwaith calon, it's heart work. And, you know, it's a really unusual and critical space to work. Today has been so diverse. We've been working with about 400 practitioners in a professional learning space. I've been working with a government team who are doing high level work in terms of government work, and they've had some bespoke professional learning. I'm now talking with you. We're working in different spaces, and it brings amazing opportunity. I don't know if some of the team from Welsh Government are here from childcare, play and early years. Rebecca Johnson and I co-chair a governance group, and that is really hearing the true voices of community mentors. It can be really challenging and emotional, but so inspiring to hear. There's a community play group which is stemmed in Somali ways of being, knowing, wisdom, language. It's incredible. It's merging other perspectives, for example, Montessori. It's just incredible to hear and start to know really what's going on out there, and building up that sort of connective trust between policy, practice and academic theory. I suppose the leadership approach is really multidisciplinary, and where we're putting our attention is the professional learning. And it's shifting from race evasive or non-racist to anti-racist, really thinking about, okay, so what does anti-racist leadership mean in the context of? And to be honest, as an early years academic, I'd much rather be thinking about re-indigenising and rewilding play in the forest, because I'm an outdoor play and learning lover, I suppose. I've created the Outdoor Play and Learning Centre in Cardiff Metropolitan University, where I'm based, but I don't get to play much outside at the moment because we've got this opportunity of time. So there's a lot going on in Wales, and there's a lot more to do. We know a lot more about the workforce in education, and we know that we need to have a lot more data around the workforce. If we think about how whitewashed that workforce is, but really thinking about supporting culture and curriculum and community ethos is really inspiring when you get into the learning and people's engagement in the deep learning. So we're not talking about a one-off, but we're really thinking about this in a safeguarding perspective, in a culture, in a curriculum ethos, and thinking about that long-term, really affective professional learning. And so hence my story of Grampi Saeed comes into it, because these professional and personal stories are really important. I had a conversation around motherhood the other day, and we were using the image of the black fetus, which in our community, when that came out on social media, you know, around the lockdown period, it was a very, very emotional experience seeing that as a mother, seeing a child that resembles yours, and that sense of what it resembles in terms of belonging is really important. And we have lots of conversations around institutional experiences in health, and then childcare and so on. So there's great opportunity, and there's amazing work going on, and there's a lot more work to do. So it's as troubling as it is inspiring. I don't know what's been shared before, because I'm sorry I couldn't come in and listen up until now, but I think there's so much synergy in terms of the report and what we all need to pay our attention to. And if from our perspective we think about safeguarding and anti-racism as a core breath we take each day, then we've got lots of opportunity to do better.
Thank you so much, Chantelle. That was really, really fascinating and interesting to hear. Well, not just your practical experience, but I think that real emphasis you laid on the emotional aspects of this, and reminding us all that it's a very human endeavour. It's about people at its heart. So thank you. I think we've had some absolutely fascinating perspectives, both from policy and from practice. I think we should be under no illusions about the challenge that we are facing, both for increasing access to childcare for disadvantaged communities in general, but also for minority ethnic families. And I suppose some of the things I heard were the vital importance of building more inclusive practices and approaches, and thinking about how we can really embed that sort of that family-oriented, community-oriented experience. It's interesting, I think, to think about the importance of those community relationships and workers as well. That came out very strongly in the IPPO research, and I will confess it's not something I would have immediately thought of as being such a critical factor in access to childcare. Given that one of the key findings of the research is that whilst focusing on cost is important, it's critically important, it is not by itself sufficient, and that actually things around workforce issues and things around our approach to inclusive practice and to diversity and the community relationships are just as important. I wonder if I could ask the panel, first of all, for your reflections on what the greatest challenges are in developing a more integrated, a more systematic approach to trying to improve access to childcare for minority ethnic families. I think we'll go in order of your first presentations for this one, just because then you've had the longest rest, Rebecca. So if I can turn to you first.
We take a starting point, or we've taken a starting point that Chantelle has also expressed in her presentation, to actually say, okay, what does leadership in this space look like? And who is it that's involved? And are we getting the right types of levels of integration, levels of voice and influence into the creation of policy, into the structures of the Welsh Government? So whilst we've talked quite a lot about that sort of outward facing perspective, a sort of key starting point for us as a group working on this, so not just Welsh Government people, but people from our stakeholders as well, was to say, right, okay, we're going to do a commitment to do the DARPL training, the senior leaders training. And I actually, Chantelle and I chairing the group, I actually said, right, I want homework, reported, and we're going to tick you off. And it's that personal commitment that then has really influenced or helped influence and shape the work. So it's through being able to go on the journey ourselves that we recognize our own lack. In part, look at the I know that we don't necessarily see the full diversity from the images that are on the screen, but it tells a bit of a story. And one of the things of working with Alexis and Amanda, I've always said we need to bring in the voices of people who are most affected, the people who we're trying to affect, to sort of influence change. So I think that would be the starting point for me, because how can we get effective change without listening into that policy making space? And then from there, you sort of reach out and move on.
Thank you very much, Rebecca. And Neil, your thoughts?
I think I probably alluded to the main barriers for us are financial accessibility and that whole intrinsic link between poverty, dare I say, and ethnic minority groups. The fact is that you are less likely, if you're living in an area of disadvantage, to be able to physically access an early years place. And there are no biases or programs that weight towards addressing that position at this particular point in time. So unless policy changes, that will continue full stop. I think the other factor for us that we have experienced is one of cultural preferences. And it's interesting, I had a conversation with a minister, education minister in Sweden, and talking about having to bring in compulsory attendance for preschool children. And when asked why, their rationale was that, their words, not mine, but minoritized groups basically had decided to care and educate their children at home. And those children were arriving at school with what they deemed to be delays, educational delays. So I think it's twofold here. One is cultural, and one is the biggest one, of course, is accessibility.
Thank you, Neil. Miriam, let's bring you in.
it's interesting that you say not cost, but then there was a comment about engagement, so training for policymakers, but also hearing the voices of the parents, and then also the people on the ground doing the work. And quite often there is cost involved in that. So I think it's really, for me, it's about investing in this learning that we can get from the parents and supporting the cost that's involved in that. So sustaining those community projects, you're on the ground supporting this education access, so non-statutory partners.
It's a really important point to not just focus on the ticket price, I suppose, but the other costs involved. Thank you. We've had a couple of questions in the chat which relate, I suppose, to questions about the balance between policy that is very specific and targeted, whilst also being sufficiently broad to serve the needs of the wider community. So we know that minority ethnic is actually quite a big catch-all term. How can we ensure that policies can be specifically targeted to groups within that catch-all term? The question in the chat talks about, for example, refugees and asylum seekers. But also, how do we ensure that policy is sufficiently targeted whilst recognising we are living in a world with going through quite a lot of turmoil, seeing quite a lot of change, and we probably need policy that can adapt to that. That's quite a tricky one. I'm not going to make a habit of this, Rebecca, but I wonder if we could come to you first, because it does sort of relate to policy making.
There was a lot in that question as well. The nature of our global majority communities across Wales are different in different parts of Wales. And we need to take an approach that is highly nuanced. So what's crucial for us as the Welsh Government is recognising that we are not the closest to those communities. So we work closely with the local authorities, and then we also have really rich and fruitful partnership arrangements with the representative organisations and seek to connect with settings. We also work hard to have an integrated approach. So we've got parenting support, we've got Flying Start, which is our flagship early years programme, which takes a really integrated approach. And one of the beautiful things about Wales is how well connected we are. We love to connect, we love to make personal connections, and that means that when it comes to kind of culturally seeking ways to be able to understand the stories of particular communities, that's kind of in that there's to a degree that's in the way that we work. However, I recognize that unless we have effective routes through to be able to hear those voices, to hear the needs of those communities, and respond to them with things like checking what our barriers are for accessing our particular programs. So that's one of the things that we really have sought to address, particularly with our Flying Start program, and to make sure that there's the right kind of geographic provision. And some of that, the challenge around knowing what those communities need and how we can respond to it, is the challenge around research and data. So I think I'm proud of the progress that we've made, but I don't think that we'll ever stop kind of seeking to achieve, in that there's always more to do. So that isn't me saying that I'm proud of our work, isn't me saying that we've done enough, but rather that actually we're recognizing the scale of the challenge and the need to work collaboratively. I think there are some key things around communication as well, making sure that the stuff that we're doing is easy to understand, is accessible, is in the right channels, etc. And that's been one of the things that's come back quite loudly from our community mentors as well. So there's just some reflections. Thanks, Sarah.
Thank you, Rebecca. So Neil and Miriam, I'm keen to hear your perspective, I suppose, from the provider viewpoint on how you achieve that balance of specificity and, I don't want to say universality, but something that is works for wider communities.
I think from our perspective, the fact that just about every policy in England is focused on work, and as I said earlier, getting mums back to work, means that asylum seekers and refugees, of course, do not fall within that category. And so whilst we have this universal offer, it's for 3 and 4-year-olds, but not beyond that. And it is interesting that in the last 5 years, I have met every single early years minister in England, every chancellor, every secretary of state for education. Not once have I ever been asked what might be in the best interests of children. All the conversations are about GDP, return on investment, etc., proving output. And that is fundamentally the problem. Until we put back the child into the equation and the child is at the center of everything, things will not change. Because if that was the case, you would not be thinking about the immigration status, for example, of people in the country. You would be ensuring that ethnic minorities were catered for and supported, and there was no marginalization. But that has not been the case for several years now. So for me, that's what needs to change, frankly. The child back at the heart of everything that we do.
Thank you, Neil. That's great. Let's bring in Miriam and Chantelle. I can see your hand. Thank you. If you wanted to offer any reflections as well.
I just really agree with what Neil was saying. Very much there has been this push to have education be associated with work. So how can we make families engage in in early years nursery provision, and how can we make that accessible for everyone so that the parents can go to work? And it really just upsets me because it isn't, the heart of the child is not at the forefront. And there was an event I was at in Glasgow, and there was lots of different people there representing the government, and there was a comment made, well, can we just increase the ratios? And that upsets me because that's not putting the children first. That's putting the amount of children in childcare first so the parents can go to work. I'm very passionate about that. So now you've mentioned it, Neil, I can't think of anything else. But yeah, I think children first, definitely.
Great, thank you. That's really clear from both of you. And Chantelle.
Thank you so much. I'd just like to add to that holistic approach to the child being right at the heart of it. I see Rebecca on the screen, and we had lots of conversations about how our community mentors, for example, feel about the context of taking their own children to childcare and what that means in terms of the culture, the issues around workforce. And, you know, the child does have to be right at the heart of this. And maybe there are other reasons why families are choosing alternatives and so on. So this is a long game. As Rebecca said, there's phenomenal work going on in Wales. There's lots and lots of evidence building. However, this is a long road that we really need to be thinking about in terms of, is the provision fit for purpose, and who is it inclusive for? How inclusive is it? Because, you know, we know as childcare, play and early years thinkers, we think holistically, we think inclusively, but people are considering whether or not that childcare is best for them. How diverse is the workforce within their local childcare setting, which is on their way to their daily routine and so on. So I think we really need to be thinking about the long term as well as the short term constantly, and, you know, looking at diversity in terms of recruitment, retention, professional learning, all of those things come into play. I suppose I'm not giving any answers, but there are a lot of barriers for parents choosing to hand their child over. Maybe thinking about the experiences. I talked about the black fetus earlier, and the sense of evasiveness, the non-belonging, the non-conneving, as we would call it, you know, not being complete in healthcare experiences when you bring a child, or before you bring a child into the world, and then when you do bring your child into the world, how that experience then goes from healthcare to childcare and so on. So it's so complicated, and I think that we're learning a lot in Wales, and there's a big shift, but there's such a long way to go. So I suppose I'm just raising more issues, more questions, but the child at the centre, and also more to do with the family as a whole at the centre, is really, really important, I think.
really helpful, Chantelle. Thank you. Rebecca, I can see your hands up. I'm just going to try and bring another couple of questions out of the chat, and then you can respond to which of those you'd like to, and the additional points. There's quite a lot in the Q&A now about the importance of foregrounding children's voices, parents' voices, which is something you've all emphasised as well. I wonder if I could ask you to think specifically on what are the sort of the methods for doing that. Somebody's talked about what the role of the Children's Commissioner might be, but more broadly, what are the key institutions that need to be hearing parent voices, children's voices, community voices? So how do we build on the partnership approach that I think you've all emphasised in different ways? And then I'm just conscious of time. So the other question I would really like us to touch on is the one that's come in about the data. So what data, you've all talked about, I think quite rightly, the importance of improving data, but what data specifically do we need, both to support decision making, but also to track progress? So I suppose hopefully we can see that things are getting better over time. So let's mix things up a little bit, if you're content to wait, Rebecca. Let's start with Neil, if we can.
On the Children's Commissioner, I work quite closely with the Children's Commissioner, and so I hope she's not offended by these comments, but I think the remit is way, way too wide. And this is specifically about the early years. And most of the data coming out of the Children's Commissioner's office has been about school-aged children, frankly. And so I think the remit is too wide. I would also say that given that the importance of the early years, that's the first 5 years are absolutely critical. That's where we shape the life chances of our future citizens. And there was a comment in the chat about, you know, with everything that's going on in this world, I can't help feeling that if we are, and we've had some awful incidents in the last few months, but if we are to have any hope of still being on this planet, dare I say, and I try not to be too miserable, but in 200 years' time, you start with the early years and everything else will flow. Get it right in the early years. These children will go on to pay more tax, they will cost us less on health, and they will cost us less on crime. So from a Children's Commissioner's perspective, I think that it is too much of a remit. And my answer to it all would be, given the importance of early years, we should have a cabinet minister specifically dedicated to early years, where you combine everything from marginalisation to health, to education and care, etc. Because, I mean, it sounds incredibly hackneyed, but without those future children, I'm not sure what we have. There's no point in creating material wealth if you don't have a wonderful, nice population that wants to share it and wants to care. Somebody, I'll shut up after this, but somebody asked me the other day, I was talking to some students, and they asked me, what does a successful child look like? And it isn't a child that can recite the alphabet. It isn't a child that can, and I'm talking a young child here, of course. It isn't a child that can count to 100 or recite 3 planets or name 3 planets. It's a child that has qualities such as kindness, empathy, gentleness, love, etc. All of the soft things. That's what I think is the priority.
Thank you, Neil. And you say all of the soft things, actually, they're the fundamental things, aren't they? They're not soft at all. And I think we think of them in that way at our peril. Miriam, can we bring you in, and then Chantelle?
Yeah, so I think that the key thing is the data. So the projects on the ground are getting lots of data. And I think sometimes that can be overlooked because the voices that are heard are often the ones that are in the forefront. So they are very much the white, and in Scotland, white Scottish parents who are there and happy to have their voice heard, and that can inform a lot of decisions. But actually it's having the voices of the quieter families, for whatever reason, they can be very much overlooked. But the groups on the ground, they have that data. Unfortunately, there has been a bit of a shift, I feel, and people doing research and come to us wanting their parents to participate in research. Lovely to see, but it can be a lot for parents every week who are coming to play with their children to suddenly be asked questions that want to have their opinion heard and things like that. But in saying that, obviously I'm very passionate about having those voices heard. So how do we balance that? The work that we are doing, so the current funding we've had to do this test of change of having a flexible option of childcare, we are working in partnership with Caledonian University to really research this work. And it's like, as you were saying, some things in early years are really difficult to document. Some of the learning, some of the development, it's really hard to quantify. And then also, I mean, what is the impact going to be in 2 years' time? We can't tell you that now. But I'm hoping that this research study will give really good information to prove. So to prove, like, we know what we're doing is good, we know it's effective. How can we prove that? But the only way we're able to do that is because we've had support from funders who are willing to invest in that research. So I think that's going to be really useful.
Great, thank you, Miriam. Chantelle, we'll come to you next. If you could try and keep your remarks.
Yeah, thank you so much. I've got a few points. So I think research, short-term, longitudinal, is absolutely vital, but we really need to be crucially thinking about the diversity of the research teams that are funded. There has to be Black and brown people in the research design phase, in the research data generation phase and analysis phase, all the way throughout. And that is absolutely crucial if we want true voice and we want complete equity in terms of buy-in. Also, I think something that's really inspiring and hopeful from our stories in Wales is that very interdisciplinary approach to gathering evidence and thinking about the wider definition of research. So, for example, we are doing a longitudinal piece of work over time in professional learning with all the leaders in the care inspectorate Wales. So the leadership team there are part of a regular professional learning space with DARPL. Every single inspector in the care inspectorate Wales is part of the DARPL professional learning perspective, and there's some deep days, and it's a real programme of work over 2 years and probably longer. And they are part of, this culture of research and inquiry, and also enabling that amongst the leaders that they are then going out to support and challenge through inspection. That's just one of the sort of higher tiers that are working in a professional learning space. So I think we can rethink about how we can use our creative and playful minds about being active in this space for research and inquiry.
Brilliant. Thank you, Chantelle. And Rebecca, over to you.
Thanks very much, Sarah. So I wanted to come back to our early childhood play learning and care plan, and we very much put children at the heart of our approach and take a cohesive approach to parenting, childcare, how we support the sector, qualifications, training. It's looking at all of that through an anti-racist perspective. And I think that whilst there's that challenge about how we hear the voices of children and the voices of parents, and we've got some particular things around lived experience projects, it's important to note that actually we need to be considering housing, we need to be considering access to health, etc. And it's so as much as possible, we need to take an holistic approach rather than sort of say, okay, all of this needs to be solved in one policy area. So this is one of the things that we're seeking to do at the Welsh Government, is to take that full picture and to make sure that everything that we do is anti-racist, which is why the Anti-Racist Wales Action Plan, whilst there's a chapter on childcare and play, the plan covers everything that we do, including shining a light on our own practices as well, and our own cultures and recruitment, etc. So I'd really sort of reflect on that, and I know that we're running out of time. In terms of the data, we need to have that balance of long-term data. We are looking to plug gaps when it comes to there being sort of small amounts, so not being able to get enough actual numbers through. We're seeking to plug that through these qualitative research projects and courageous policy conversations. So rather than sort of saying, oh gosh, this is too hard, okay, how can we think creatively and do this another way?
Brilliant. Thank you all so much. I think that need for a holistic approach has come through really strongly from the discussion today, as is the need to put community voices and needs at the heart of future policy making. I think I only have time to thank very much our wonderful panel for sharing their wisdom and their insights. It's been such a fascinating discussion and really illuminating, I think. To thank Alexis and Amanda for introducing the report and all their work on the research, and to thank you all for coming. Please do take a look at the different publications that have come out of this research on the website, and do get in touch with the IPPO team if you want to find out more.